Hello. I want to wear this thing right. Hi, guys. How are you? How are you? How are you? How are you? hmm This is your girl, Lisa Baxter. Let me get myself straight and situated. Give it a little slizzant. hmm Okay, I'm talking to you guys tonight mhm, on community help services and resources. I'm not even going to be long before you. How about that? I work for Dreyfus Health Policy and Research Center, and I also worked for Dallas's Clinics Incorporated, and I work for Rise Up East New York. It's an all-in-one umbrella thing. But I said that to say this is that we like helping the community out and we like helping different neighborhoods out as well. So we got, different campaigns we do. We go to health fairs, street fairs, job fairs, senior centers, schools, colleges, all kind of stuff. Um, to give out resources to lend a hand of the things that we do. I mean, we have doctors in the office, nurses in the office, administrators in the office, counselors in the office, social workers in the office, health campaign managers and stuff like that in the office. And we are right in reach of Brooklyn, but we help everybody and anybody. But East New York and Brooklyn is one of the key places and points. I want to give you a little information. I'm trying to do something called healthy actions where you go to a clinic or a program in the neighborhood that you could have the resources set up right there, so when a person comes for a checkup and they need something else, maybe a job or a training or something else, they could get it while they're coming to get help. For one thing, they could get other help as well. Maybe they need food, maybe they need I don't know, maybe they need extra money or training or certain programs, maybe some of that we know about or have on the list, so we don't, that we can still refer the person to. So we're trying to do that inside of the doctor's office, the eye doctor, the clinics and stuff like that. And even in any other program that would have us. So I offered it to a lot of places, the colleges, the school. Sometimes it's instead of having a big thing where all the different tables and stuff, which is always good too. But sometimes if you have the little intimate thing, two things. I would have maybe a person that give out free phones will come. He'll have a table and I will have one, giving out different things. You know what I mean? So maybe a scholarship or maybe a program that you might want to do where you get a certificate from the workshops, from like the nutrition workshops that can lead to work or a job experience or part of your resume. And they hire as well as train. So I'm just saying, sometimes it's nice. That's just a little idea I have. And then now our team is doing a lot of good things too. We're doing some things with NYCHA. And in the NYCHA buildings, there's 11 NYCHA buildings in East New York. And we're going to be working with two of them, to get some screenings and stuff like that done. And while they get screenings, if they don't have a doctor, we can always refer them. And if they do have a doctor, then they can, if they find out they have diabetes or high blood pressure or any other thing through a little blood or a little, in a little prick or a little, from a little thing, nothing deep. You know what I mean? If they can find out, something early, then that way they could get a doctor if they need it, get treatment if they need it, be on top of it if they need it. You know what I mean? So we're just trying to help in any way we can, no matter what disability you have, no matter what age you are, and things of that nature. We have a Facebook page if you ever look up Rise Up East New York or riseupeny.org. Okay. Um, I just wanted to tell you some of these things so you know a little bit more about us. Plus, you'll give us more of a chance. I mean, a lot of people already deal with us, partnered with us, and stuff like that. And we don't only do this, but we partner with other organizations and programs and companies in the community. So you'll know that that one is down the street. You didn't know that doctor office was down the street, or you didn't know they was hiring down here. You didn't know they had a union program over there. You whatever, it doesn't always have to be health, because anything can make you sick. Your money ain't right, that can make you sick. The bill's not paid, that can make you sick because you're worried, you're stressed, you're aggravated, and that causes other stuff. So we're trying to help all the way around the best that we can, and whatever we can't do or we don't know, we should be able to refer you, point you in the right direction, or at least try. So I believe we can do it, and we've had a lot of years of experience doing things of this nature and stuff like this. So I just wanted to put that out at you. Let me see. Okay. All right, so we talked about the screening program a little bit. All right, so yeah, 11 NYCHA housing developments in East New York. That's 8,179 apartments. Woo wee. Wow, that's a lot. That's a lot. So we're gonna try to do this through February and March, and we'll start out with two, and then we can put some other ones on. So please, if you are interested in help or anything like that, feel free to contact us through the website. There's emails through the website as well, a general email. We also got a number 347-417-5368, extension 2003 is mine, but we all have extensions there. Okay? Excuse me. All right, let's see. This is one of the things we take. This is our barcode thing, and we give out prizes with this barcode. And all you have to do is scan it and fill out the questionnaire and get cool prizes. So every time we go out, we take this with us, so people are gonna get a chance to scan it, to do it, to view it, to look at it, and everything like that. So it says, I'll tell you what it says. It says we provide health and wellness information, nutritional tips, access to resources and stuff like that. And they also have the number. They have our website, and our address is 240 Cozine, Brooklyn, New York, 11207. If you enter the office, you have to have proof that you've had your vaccination, your shots. Okay? All right. That's to protect you and other people that may be in the office that uh, can have high, problems, you know, like myself who had a transplant. You know what I mean? Sometimes it's your age, sometimes it's something that you're dealing with that make you that way, and they've been saying that all year. But this is one of the flyers we got. We got so many flyers. We got flyers on asthma, breathing. What is another one? We have what is it? Asthma, high blood pressure, diabetes, colon cancer. So we have flyers on all kind of stuff. Even the different. We were doing all kind of help with jobs and stuff like that, and internships and volunteering and mentoring ships. So we oh man, we were dealing with some people that was helping people to get on the job training. It was just good, so check it out and give us a chance. So okay, this says kidney health facts. All right, and we dealt with colon cancer too. All right, anything you could think of, we've been dealing with it. You know what I mean? Even dental. Help me, Shondo. You know, kidney works 24/7. Look after them. Your kidneys are very important. You hear me talk about that all the time. So you got to look after them. So I had some of this stuff hung in different stores and different supermarkets and different clinics and grocery stores. All kind of things where people are or people go to. You know what I mean? Because this affects anybody that got a kidney. So whether you're a baby, a child, anybody can have a difficulty or a problem. High blood pressure and diabetes, especially diabetes, is the number one that causes kidney failure and kidney disease. Not drinking enough water. You can live with one kidney. But certain pills and over the counter and sometimes prescription pills can also stop the kidney from working. You got to do your homework. You got to know your body. You got to know how stuff affect you, how it affect your body, and share stuff with your family. I always push that. Some people say, "Oh, I didn't know they had that. Oh, I didn't know she had that." What? And they said, "What's the name of her pills? What? When did she started that?" And nobody knows anything. You gotta share information. It's love to do that. Trust me, it's love to do that. I always told them this thing is very small at the bottom. People can't hardly see that. But info at riseupeny.org is also one of our emails. Okay. I like the little things that it have on the back of this, which I'm going to read off to you. Okay. I hope y'all enjoyed the yesterday's thing about the fun and games and stuff like that. I hope that brought you back, and I hope you were able to use that for family and friends. Okay, protect your kidneys. Protect your kidneys. You gotta protect them. Okay. Um, Kidneys are the size of your fist, and um, and have many functions. All right. They filter your blood, remove toxins from your body, and they help the right amount of fluids through the system. All right. This is a good thing to keep around, a good thing to have, because everything is quick and it just have a little picture and a little information, and it can stay in your mind very easily, and it's easy to share. That's why you heard me say things and do things on kidneys plenty. But I wanted to read this because I was just in love when I saw it. And they said, "Oh, Lisa gonna like this," and they was right. Miss Nancy was very right. Eat healthy, be healthy. Say that with me. Eat healthy, be healthy. All right. Eating healthy, and decreasing salt and um, processed foods will lower your blood pressure and lower the risk of damaging your kidneys. So you don't want to have any salt things going crazy in the body, because high blood pressure out of control kills the kidneys. Diabetes out of control kills the kidneys and causes damages. And diabetes is the number one cause. Make I can only read this, and it's not that bad. Make a no smoking rule in your house. Nobody smokes in my house. I remember before nobody would listen to me or pay me no mind, but I had to get really serious and tell them how much I love the Lord for them to cut it out. When you're the youngest sometimes, or people just think because you're soft, not that soft, but they would do it. So you have to be a little stern, a little clear. You don't want it. And secondhand smoke is no good for nobody. You may have children, God forbid. Now stuff affect the pets. Who knew? All right. Smoking increases the risk of kidney cancer. You heard me? Kidney cancer by 50%. That's half, but that's still a lot. You know what I mean? And slows the blood flow to your kidneys. You don't need the blood need to flow straight. You know what I mean? You don't need it to be flowing slow or too slow. Circulation is good too. You got to get your blood going, your blood moving, and exercising and stuff. Okay, talk to your provider, your practitioner, your general practitioner, your doctor. Okay, have your kidneys function test regularly. So have them tested regularly. Yeah. All right. And a simple blood test can measure how effective your kidneys are working and how well they are removing the toxin from your body. You're going to want to know that. I got to go next week. Matter of fact, this is Sunday, so it's this week. I have to go because I go to Mount Sinai every so often to check on Hannah, which I call my kidney. So you got to look after these things. You got to look at it, take notice, pay attention to your body and the signs. Okay, talk to your healthcare provider about what over the counter medications you take, um, to be certain that they are safe for your kidneys. Same medications such as painkillers can damage your kidneys. Well, they got a lot of stuff that can damage it. So talk to your practitioner. The sentence is like you're talking. So when I'm talking, and then I go back to it. Manage your chronic disease. So if you know you got a chronic disease, manage it. All right, all right. If you have chronic disease such as diabetes, high blood pressure, keep them under control. If your kidneys fail, you will need dialysis or a transplant. I was on dialysis 12 years and I did get a transplant as well. Okay? Diabetes, hypertension, and obesity put you at risk for kidney disease. You heard that? Obesity. I've been there. I used to be 214 pounds. For 8 years, I was heavy. And I was able to keep it off for over, 12, 15 years now. Oh, yeah, long time. You know what I mean? I gain and lose and gain and lose, but I've never been that big again or heavy again. I don't want to be. You know what I mean? I was active, but still, even though with being active and being able to move doesn't still mean it's good for you. Okay? Be active. You see this guy running. I'm going to try to get all of these close pictures. I'm going to do a nice up and down and slow. You got that? Child. Okay. Find an exercise or activity that you love and do it daily. That's nice. Get some fresh air. Fresh air is always good. I even try to get it through the mask and take the mask down sometimes, as long as it's safe to do so. A simple walk can make you healthier and happier. All right? Decrease stress and well controlled blood pressure can help your kidneys function better. Isn't that something? All for walking, all because you're active, all because you're exercising. Wow, I love it. As a general goal, aim for at least 30 minutes of physical activity every day. Find something. I do like to walk. I miss running. I'm going to get back to that. I'll do that again. I run with the walker sometimes. But I think I'm only doing that in church. I'm under the spirit. I know without the spirit, I hope I don't fall. You know what I mean? But anyway, I just wanted y'all to get, and that's cute, the little thing. But you boil your fist up like that and notice your kidney is that size, and you got two of them, and they function and they work. Give them plenty of water. You know, keep out those infections. Infections can bother you. You don't want any infections and stuff like that. Help us to help you. Whether you want to do any project with us or any workshop with us, you may want some help or want help for a friend or family member that live in New York or live in the five boroughs or don't even live in New York, period. But whatever you do, we will help you and we can help you and find a way to help you. All right? So take care of your kidneys and they'll take care of you, I always say. All right? I ain't mad at you, but I am mad about you. All right? And I want you to be healthy and strong and happy and feeling good and well. And once you know that and learn that, you can pass it on to somebody else. Each one teach one. You know what I mean? Like you pass any other good information or something good, pass this. This is health is wealth. You can be very wealthy if you're healthy. How about that? Look how I just flowed. Woo! I love you guys. Thank you for your prayers. Thank you for your love. Thank you for tuning in. Thank you for sharing. Thank you for caring. Thank you for posting. Thank you for liking. And thank you for helping me with maybe some ideas of different topics or shows or something that you want to hear or know or want help in. All right? So take care of yourself. Be well. Be good. V for victory. All right? And have a nice evening. It's Sunday and I'm going to relax till I have to go to work on tomorrow. I have to get myself prepared and ready for that. And I am looking forward to that. How about that? All right. I love working. I love my job. I love what I do and the people I do it with. My Pastor Lois used to say that. My First Lady and Pastor Lois used to say that. Happy birthday to the February people. Happy birthday to the people of 2023, whatever month your birthday fall in. All right. I love you, and I'm praying for you. Bless your life. Shando Koboshe Rabashia. All right, now. All right. Be healthy, wealthy, and wise. Good night. Hope I'm not forgetting anything. I always say that, and then after things is over, I find one or two things, but that's all right. What need to be said is said. Thank you. Knowledge is power. Peace.